Welcome to the presentation. Today we'll be talking about reducing anxiety in pediatric patients.
The researchers involved in this project include Amelia Tooley, Morgan Link, Ava Laporte, and Mike Blaze. Our initial clinical question is, what is the best way to reduce anxiety in pediatric patients? This clinical question is a knowledge-focused trigger and is in the therapy category, which tests the effectiveness of treatments. The searchable question we developed is, among pediatric patients, did play therapy compared to no intervention affect anxiety? In our initial PICO statement, our population was pediatric patients, our intervention was play, our comparison were other alternatives, and our outcome was anxiety. This evolved in our final PICO statement, where our population was pediatric patients, our intervention was play, our comparison was no interventions, and our outcome was anxiety.
We had three conceptual definitions. The first was anxiety, and we used the medical definition, which is an abnormal and overwhelming sense of apprehension and fear, often marked by physical signs, such as tension, sweating, and increased pulse rate, by doubt concerning the reality and nature of the threat, and by self-doubt about one's capacity to cope with it. The second was child, which we defined as a young person, especially between infancy and puberty. The final conceptual definition was play, which was defined as to toy or fiddle around with something. All of these conceptual definitions came from Merriam-Webster.
In our search strategies, we use CINAHL as our database. To search the database, we use subject headings based on our three main concepts. Anxiety, our first subject heading, yielded 55,226 results. Child, our second subject heading, yielded 728,834 results. Play therapy, our third subject heading, yielded 1,307 results. When we combined these subject headings, it yielded 79 results. Of these 79 results, we found 29 that were relevant when we refined our search, based on the year, whether or not it was a research article, and being in the English language. In our final article selection, we chose the 4 best sources based on if they were peer-reviewed, if they had similar interventions, and the dependent variable of anxiety.
The general purpose of all our research analyzed is to evaluate the effects of play therapy among children with anxiety.
Of our 4 articles, we have 2 randomized control trials of level 2 evidence. These include Gastan et al., which looks at the effects of group play therapy on anxiety in children with leukemia, and also He et al., which looks at the effect of individual therapeutic play on children undergoing elective surgery. Our other 2 articles consist of quasi-experimental studies of level 3 evidence. This includes Hatelli, which looks at the effects of non-directive play therapy in outpatient children who have been diagnosed with an anxiety disorder, and Zagan et al., which looks at the effects of play therapy in postoperative pediatric liver transplant patients. All of these studies used a pre-post test design.
All of our research studies began by collecting demographic information on the patients in their samples. All of our articles use anxiety scales with reliability scores of 0.87 or higher to measure the levels of anxiety and effects of the treatment. The study of children diagnosed with leukemia used the multidimensional anxiety scale for children, which measures 4 dimensions, including social anxiety, separation anxiety, harm avoidance, and physical symptoms, with a reliability score of 0.87. The study of children undergoing inpatient elective surgery used the state anxiety scale for children, which measures level of anxiety with a reliability score of 0.88, and the Children's Emotional Manifestation Scale, which measures negative emotions, with a reliability score of 0.92. The study of outpatient children who have been diagnosed with an anxiety disorder used the Spence Children's Anxiety Scale, which identifies symptoms of anxiety, with a reliability score of 0.89. Finally, the study of children post-liver transplant used the State Trait Anxiety Inventory for Children, with a reliability score of 0.88 to measure anxiety, and the Medical Procedure Fear Scale, with a reliability score of 0.89 to measure fear.
All articles had elementary age participants ranging from ages 6 to 14 years old, and 3 of our articles had inpatient children, and 1 of our articles had outpatient children. In the study of children diagnosed with leukemia, the subjects were ages 8 through 12 had to have a diagnosis of leukemia and symptoms of anxiety. Patients were excluded if there was a presence of physical problems that prevented the child from participating in play therapy sessions. In the study that involved non-directive play therapy, subjects were ages 7 through 9 and had an anxiety diagnosis and a psychiatric interview. Exclusion criteria included 2 absences, a lack of cooperation, taking psych drugs, receiving other treatments, and having a medical illness. In the study of postoperative children, subjects were within the age range and were undergoing inpatient elective surgery. They were excluded if they had past surgical experience, special medical care, or a disability. And lastly, in the post-liver transplant study, the 65 subjects were ages 6 through 12 and were stable second post-op day of the transplant. Subjects could not have any systemic disease or disabilities. They also could not be reluctant to play.
Let's review our findings. Gastan et al. Found that inpatient children diagnosed with leukemia who engage in group play therapy have significant decreases in social anxiety, separation anxiety, harm avoidance, and physical symptoms, all with a p-value of less than 0.001. This finding means that play therapy reduces social anxiety, separation anxiety, harm avoidance, and physical symptoms in children with leukemia, opposed to the control group of no play therapy. The study's findings fully support the initial hypothesis. He et al. Found that children who completed the play therapy intervention had decreased anxiety compared to the control group. Preoperative anxiety reduced significantly in their intervention group with a p-value of less than 0.05. Children in the intervention group had significantly less negative emotions and pain after surgery with a p-value of less than 0.01. Children in the intervention group also had lower anxiety scores postoperatively, but the results were not significant when compared to the scores of the children in the control group. Hatelli found a statistically significant decrease in total anxiety of the intervention group, who participated in non-directive play therapy in the outpatient setting, with a p-value of 0.035. The mean score in total anxiety dropped by 53.8 points after the non-directive play therapy intervention occurred. Zagan et al. Found a statistically significant decrease in the level of anxiety and fear from the pre-test to the post-test, with a p-value less than 0.001. The State Trait Anxiety Inventory for Children scores went from 49.1 plus or minus 8.5 to 31.5 plus or minus 4.9. And for fear, the scores from the medical procedure fear scale went from 69.7 plus or minus 13.5 to 38.9 plus or minus 7.1. All in all, our evidence found a significant reduction in anxiety from the play therapy interventions.
All 4 articles had similar limitations and strengths. For limitations, all the studies had weakened intervention fidelity due to the nature of play therapy needing an element of individualization. The element of individualization requires the clinician to tailor the play therapy experience to each patient. This can greatly impact the intervention fidelity because the intervention may not be given as effectively to each patient. This is common among all the studies. All the studies face potential testing limitations due to the pre-test, post-test design, as subjects may remember their answers from pre-test and apply the same ones to the post-test. This threat could have skewed the results in some of the studies. Throughout all the studies, either convenience or purposive sampling were used, which reduces the generalizability to greater populations and requires more research to be done about different groups of people in different geographical locations. The major strengths of the study include the use of measurement instruments that had high reliability scores of 0.87 or higher. This ensures that the measurement tools are always accurate in what they are measuring. All the studies also include clearly stated strong ethical considerations in the form of institutional approval, informed consent, the right to withdraw at any time for any reason, and patient confidentiality.
Based off our synthesis of the presented research, we recommend further research with greater sample sizes to increase the generalizability, testing the effects of play therapy on patients undergoing more diverse procedures, which would adjust for different levels of anxiety, and conducting more randomized control trials to imply causation. Additionally, we recommend examining the different types of play therapy to see which method shows the greatest effectiveness to decrease anxiety. As a group, we give this research on play therapy a grade of moderate certainty.
Best evidence is that play therapy will decrease anxiety in pediatric patients. The patient-parent values are to create a low-stress and peaceful environment with minimal fear. The parent-patient preference is no medications to treat the patient's anxiety. Clinical expertise is to offer play therapy in different modalities and types that can be individualized to each child.
Implications for nursing practice we have discovered in our research entails that play therapy can be a cost-effective solution to manage anxiety in pediatric patients. Additionally, nurse-guided play therapy could increase trust in the nurse-patient relationship, but could also become another stressor for the nurse, especially when considering potentially high nurse-to-patient ratios. Play therapy is well within the scope of practice for the nurse, giving it potential for becoming a primary intervention for pediatric patients experiencing anxiety. Some future research questions we have are: does the use of play therapy during other major procedures affect anxiety levels in pediatric patients? And does the use of direct play therapy affect anxiety levels in pediatric patients differently than non-directive play therapy?
Our group came up with 3 discussion questions based on our research. The first is, do you think our findings are generalizable? If so, to what population? The second is, do you find our research to hold importance, relevance, and significance to today's nursing practice? And the final question is, based on our limitations, what further research could be done to provide greater evidence in regard to the effect play therapy has on pediatric patients experiencing anxiety?
For more information about play therapy, please see our articles below.